Have you ever wondered what's the difference between an EKG and an echocardiogram? Well, that happens to be one of the most common questions that people come into my office to ask. So when they're about to have an echo, a lot of people will say to me, I think I already had that. Is that the one where they put the stickers on your chest? And no, that isn't. That's actually the EKG test. And they measure completely different things. So first, I'd like to go ahead and give you a brief overview about what each test is physically, and then I'm going to tell you a breakdown of what each test measures and what it's looking at and probably why you've had it done. And over the course of this, we'll also talk about how sometimes someone might need one test and other times you might need both. Now, I'm a cardiovascular sonographer. I've been doing this for over 10 years and have scanned thousands of hearts and arteries. However, I'm not a medical doctor, so this is not medical advice. This is simply education and putting things in a simple, easy to understand way of questions that I get asked every single day. So I want to start by talking about the EKG. EKG is an electrocardiogram. An echo is an echocardiogram. Sounds alike, doesn't it? So that's why a lot of people can easily get this confused if you don't work within the medical community or haven't had these tests multiple times. So let's break down first, what is an EKG? So an EKG measures the electrical signals between your heart and your brain. So how that does that is it records signals that tell your heart when to pump and how to pump. Think of it like a blueprint for the wiring of your house. And if the electricity isn't firing correctly, lights are going to be flickering, right? So in your heart's case, that would mean that the rhythm has become irregular. Now, an EKG is very quick. It only takes maybe 5 to 10 minutes. It's pretty painless. They just put a bunch of stickers on your chest and then down on your ankles, usually 12 stickers. The only time it hurts is when they take them off. And if you have chest hair, it's gonna be pretty painful, not gonna lie. Sometimes I have to pretend that I have just been cut off in Atlanta traffic by someone that I need to pull these stickers off of because that makes me feel better about it. So don't blame me, blame the stickers. But moving along, let's talk about what an EKG picks up. So arrhythmias, so that would be an abnormal heart rhythm. Also a conduction delay, which is when signals get stuck on their way across the heart. And so also it can pick up signs of a past heart attack because the electrical patterns may leave something like a scar. But here's the important thing. An EKG shows if the electrical instructions are working. It doesn't show if the heart itself is strong, if there's damage to the structure, and how the heart is pumping in live time, right? So how do we see that? That is where the echo comes in, the echocardiogram, and that's the heart ultrasound. A heart ultrasound is very simple. It takes about 30 minutes, sometimes up to 40 minutes, and you just lay on the table, and similar to someone who's having a pregnancy ultrasound, a little bit of gel goes on a probe. Very simple probe, got one right here actually. Here's the probe, put a little gel on it, put it on the chest area, and take about, 40 to 50 images and video clips. Lots of measurements. We're measuring everything, whether it's normal or abnormal. We want to measure everything so we have what's called a baseline. So with an echocardiogram, which is the ultrasound of your heart, instead of looking at the electricity, we look at the actual muscles, the valves, and the chambers in real time. And the valves you can think of as the doorways in the heart, and the chambers, which are the ones filled with muscle, is where the blood fills and gets pumped out of. So with an echo, you can see if your valves are too tight, which we would call stenosis, or if they're leaking, like the door's not fully closing all the way, right? Like in a house, cold air is just getting in from the outside. So those are called heart murmurs. We also want to make sure that your heart muscle is strong, it's pumping well, and it's relaxing well so that it can fill properly. So if it's not, then that could be a sign of early heart failure or any stage of heart failure, really. We want to see if the walls of the heart are too thick or too thin, and we also want to look if there's any fluid around the heart, which could be causing pressure and could be a reason for chest pain. So think of it like this. The EKG is the wiring of the house, and the echo is the structure and the mechanics. So here's when someone might need both. If you're having chest pain, palpitations, or shortness of breath, sometimes one test just isn't enough. And an EKG might show if your rhythm is off, An echo might show if your valves are failing or if the heart muscle is struggling to do its job. Together, they can give a fuller picture of what's going on in your heart. And it can answer questions like, is the heart strong enough? Is it doing well with the load that it's carrying? Does it have any effects from long-term blood pressure? Does it have any effects from long-term heart murmurs that could cause the chambers to get too big? So if you're talking about, do I need the EKG or do I need the echo? If you're wondering if you need both, think of it this way. Let's say you're going on a road trip and the engine of the car is the echocardiogram and the electrical part of the car is the EKG. I want to take care of both in advance. So here's the bottom line. EKG and an echo can sound alike, but they measure completely different things. And if your doctor needs a more comprehensive understanding of your heart, then it's best to have whatever tests they require in order to get that done. If you ever happen to be in Atlanta and you're looking to have a heart ultrasound or an EKG or a stroke screening or one of our many other tests, feel free to use the link below to schedule an appointment or to call and speak to us to see what kind of ultrasounds we can offer that can help you. At Atlanta Ultrasound, we do not accept insurance and therefore we don't require a doctor's order, which means if you feel that you want to have this screening and you either don't have a doctor or it's not being ordered or your insurance isn't approving it, you still have an option. Also, if this helped you, feel free to like and subscribe so you can get alerts on the next video. I don't really create videos too often, but when I feel like so many patients come in and have the same question, it makes me think that other people out there want answers too. So if you have any questions that are regarding to the cardiovascular ultrasound or health screenings, please feel free to leave it in a comment below, and maybe the next video I'll make will be because of what you needed. All right, have a great day and thank you for watching.